Good evening, viewers, and welcome to Health Matters. This program is produced by the Ministry of Health. I'm your host, Alicia Martin. We're in the month of November, and this month is also known as Oral Health Month. Joining me in studio are a few persons from the Chetty Dragon Dental School. With me, I have Dr. Kester Sullivan. He is the Director of Dental Health Services. Also, Dr. Debra Patterson, and she is the Principal Dental Officer, Acton. Additionally, is Dr. Karen Tai-Oy-Yong, and she is a Senior Dental Surgeon. Welcome, everyone.
Thank you for having us.
Wonderful. So, this is Oral Health Month. Dr. Sullivan, could you tell us a little bit about the dental school and what you guys do there? Give us an overview of dentistry in Guyana.
Okay. Good evening again. Thank you for having us here. I must say, dentistry in Guyana has evolved in the sense that from whence it started to now and where we're going in the future. Dentistry, as the Ministry of Health is trying to propose and mandate, we're trying to reach the needs of the people all across Guyana, whether the inland locations and on the coastline. Gone are the days when persons in the inland locations had to have a tooth extracted unnecessarily. No longer that type of approach will be condoned. The Ministry of Health has embarked on a program where dental health services has been improved in thus providing the necessary services that required for the treatment and the needs of the people. In doing so, what we find has happened is that those locations where health services are not easily accessible, the Ministry of Health, along with the dental team and other health sectors, go on outreaches to these locations where services are difficult and not easily accessible. Gone are the days, like I said earlier, if a person has an extraction or a tooth to be checked or any dental problems, they may either have to travel to Georgetown, to those locations where they have the services available, but due to Ministry of Health intervention, you have dental clinics being opened up and developed in all the 10 administrative regions.
Yes.
Even though some of them may not have a resident dental surgeon, when the visiting team goes to these locations, the dental team be able to deliver quality services to these people. So basically what has happened for those locations that do not have the human resources in terms of a senior dental surgeon or a dental surgeon, we may have dentists and other personnel working, but when the team goes in, we compensate by having the dental surgeon, the qualified person, increase the level and quality of treatment that is expected of us. So no longer will you say you have to do an extraction for a tooth that needs to be filled, because when we move into those locations, we have the equipment to do the necessary fillings or necessary treatment that's required. Even though at some locations where the dental clinic is available, we do not have to move with all the necessary equipment, but once the manpower is there, right, you find the necessary drug is also supplied, the equipment are up to date, and these are all functioning, right? Once these equipment and the facilities are functioning, we can deliver the services. In order to provide quality services, we are embarking on having every administrative region to have at least one resident dental surgeon. Also, another step even further, we are ensuring that every regional hospital and main facility or facility out in the outer location have a resident dental surgeon. So all hospitals will have one at least. Taking that into consideration, we have Chetty Dragon Dental Center, which is the main training facility or the main facility for dentistry in Guyana. What you find happen at that facility there, from complex or from the simplest procedure to the most complex, are being done, because we have specialists in the various areas of field of dentistry that are able to deliver the services to the people as required. Overlooking what has been going on in dentistry. We also have new sites being developed. We're in the, for instance, in East Berbice, we have Brothers Health Center. We can take, for instance, other locations. We try to expand our services to all the various communities. Expansion is important, but not expansion on the whole just to say building a clinic. It must be fully equipped, and the ministry and the government ensure that is done. It is fully equipped with the equipment and drug and supply that is necessary. Also, the human resources, dental staff must be an important component of our team. To look at the forward expansion, we have at the Chedi Jago Dental Center now, the periodontal department has been refurbished, but we have the starting or rebuilding of a new maxillofacial department down there, where we have maxillofacial surgeon, but it's not able to function that effectively because of the new development. We are supposed to be having a full-fledged maxillofacial theater, where that service could be easily given to the public. Other locations in other regions, right? You may have dental facilities, but where there are complex cases that ministry cannot, the people of the regions or those locations cannot access it, they will have to come to Georgetown when being referred. But we're trying to make sure the services in all the regions are adequate, and likewise the services given on the coastline should be the same. Those in the interland should receive the same level and quality of services that are given to those on the coastline.
Wonderful. Thank you so much, Dr. Sullivan. You mentioned such great implementations there. And
Thank you so much.
Yes, I'm sure the public are happy to hear of this, and I encourage every person listening and watching even now to take advantage of the services that are offered by the dental school. We're going to go into a short break and be right back.
Sorry. Che, when last I see you? You good?
Years, girl. But anyways, everything good though. Well, apart from this too that killing me, girl. But I going now buy a man and take it out. And you don't know he gonna want a set of money.
A set of money? Nah. Go by Chedi Jago Dental Clinic because one, they don't fix anything, and two, it's free.
What? I going there now. Plus, I gonna carry the little family. But wait, Sally, I never see straight it in your mouth until today.
And it's where you feel I fix it.
Don't ignore Restore. At the Chedi Jago Dental Clinic, our services include fillings, cleaning, root canals, treatment of gum diseases such as gingivitis, molar surgery and extraction, plus orthodontics such as teeth straightening. For more information, call 225-0702 or visit us for a free consultation. Chedi Jago Dental School. Free dental health for all.
Welcome back. Thank you for staying tuned with us. For those persons who have just joined the program, we are talking a little bit about Oral Health Month. This month of November is the month that we observe oral health. And so I have some persons here with me from the Chedi Jago Dental School here in Guyana. Could you tell us a little bit about some of the services offered across the regions and the facilities and locations where persons can go and access these dental services?
Yes, I can start by saying good afternoon, everyone. Over the 10 administrative regions in Guyana, we will have one or more facility that offers dental care. In Region 1, we have the Port Kaituma, Mambaruma. There's a dental health center there, and in that health center, there's provision for dental service. In Region 2, Region 3, West Demerara, you have Lenora, you have, we even have all the way on the other side, Bushlot Health Center. Services are provided there. In Region 4, we come down to, before there was COVID, we had schools that offered dental services. We have F.E. Pollard, we had North Rumvelt. All of these schools offer dental procedures. President's College, that's a school that has a resident dentist. So they have services throughout the term, throughout the year. On the East Bank, we have Grove Health Center that offers services. There's a resident dentist there. We have Diamond Health Center. We have in the Diamond Hospital, there's a dental department there. Region 5, we have dental service in the New Amsterdam. There's a dental clinic there. And going on to Region 6, Keldon and New Amsterdam Health Center. Not forgetting Region 10, where we have at the hospital, the Linden Hospital, there's a dental surgeon there. And also we have dental clinics in Christiansburg in Region 10. As Dr. Sullivan rightly said, we are trying to have dentists at all these
Health facilities.
processes. Region 9, also not forgetting Lethem, we have a dental, recently we have a new personnel, a new resident dentist. They were without a dentist for a while, but we have a dentist there. And the procedures that Dr. Sullivan was talking about will depend on the equipment that is there. I would let Dr. Karen go into some of the procedures that we have going on at these different health centers.
Yeah, thank you, Dr. Patterson, and good evening again. Rightly so, as she had said, it depends on the equipment and the personnel available. Now, where you don't have a standard facility, as in terms of a building, we have outreach equipment that would facilitate, to some extent, services to those areas where it's inaccessible. Right now, primary health care is our focus. And like Dr. Sullivan said, specialty areas. Now, the primary health care, we're focusing on education, prevention, and intervention from
Conception.
Conception,
to
that's the
birth.
team.
Yes, conception to birth and beyond.
yeah.
So, as she mentioned, the school program, that's where we start our education. Now we
Yes.
know small children, you tell the teachers, they listen to teachers, you tell them anything. They go home and say, Mom, Dad, this is what we've learned.
Yeah.
And in so doing, we're spreading the education indirectly through the children to parents, to aunts, uncles, grandparents. And so that thinking of, oh, I have a pain, I need to extract a tooth, they would know, well, prevention, we start off with how we brush, how often we brush, our diet, a balanced diet, which is so important. And so we go on. At the facilities, however, where we do the intervention, where we do fillings, prophylaxis, which is an integral part. Gum disease is no joke. It can tell you about a person's systemic diseases if they should have that, oral cancers and so on. So we would like people to come in so that we can actually see what's going on and individually tell them, well, look, this is your treatment plan. This is when you need to return, how often you need to return, how important it is for oral health, because the mouth is not just the mouth. It's not an organ by itself. It is the window to our body.
Definitely.
So in that sense, and the specialty areas, like, for example, the periodontist dealing with gum diseases, the maxillofacial surgeon who deals with removal of tumors, fixtures of fractures, orthodontists we have, yes, and we can talk about the prevention there, habits that children might pick up. Before birth, we talk to the mothers about when they do give birth, that they should nurse as a form of developing the jaws, that sucking action and things like that. So yes, we would like people to come and hear us out.
You know, since we're on the topic of oral health education, Dr. Karen, could you tell us and those persons who are viewing, at what age should children visit the dentist first?
Well, like we said, we would like parents to come in when if their intention is to get pregnant and so on. Mm-hmm. But for children attending clinic, we even say once they get teeth.
Yeah.
Not just to do something, but at least to have them in the chair to become acquainted with the
to be not
personnel,
afraid.
not to be afraid.
So
that
you can
sort
bring
of
them
thing.
once
Yes,
they have their
yes.
teeth.
And then it becomes a routine, like they're going to school. Hey, mom, I'd like to come and see the dentist.
Get a
And
checkup.
with all the apps going on tablets and so on, children are more aware. They're not
Yes, they
afraid
are.
as before. So we have that as
And
well.
this applies for adults too, because I know persons would usually wait until they have a toothache
Yes.
or something is
Right.
wrong with their
So-
teeth to visit the dentist. And so you guys are saying that something don't have to necessarily be wrong with your teeth for you to visit. That having that checkup is important, isn't it?
That's
Yes.
true.
Yes.
And I'd like to point out it's not just teeth. Remember, the mouth is an
Yes.
entire cavity.
Indeed.
It involves soft tissues, the tongue, the mucosa, that sort of thing. So, like I said before, we can tell from looking at the mouth if someone is struggling from a systemic disease before they even know it.
Wow.
And that's important.
What are some foods that will contribute to good oral health?
Well, like everything else, a healthy diet, balanced diet, less sugary, sticky foods. I mean, it's a shame that parents are forced sometimes because of a lack of finances to buy cheap sugary foods available for children's snacks. We want to tell them to stay away from that, to deal with more fruits and vegetables, protein, basically that. you
What
know.
is teeth sensitivity and how does this occur? I know some persons will complain of probably when they brush, they might pass a little blood there, or probably if they drink something cold, they might feel, a hurting in a particular tooth. Could you explain that and what is sensitivity
yeah.
of the tooth?
Yeah, maybe I can intervene. As we all know, the tooth, I mean, from school we learned that there's the outer region, which is enamel.
Yes.
And inside the enamel, you have the dentine, then we have the pulp. Now, when you have anything that affects the pulp, that's where you have sensitivity. Generally, everyone has a little sensitivity due to the fact to extreme cold, right? The body, the enamel protects the pulp. And as you go older, the enamel you would find older persons complaining more of the sensitivity than the younger persons. Because as we grow old, the dentil would have, there's something called demineralization of the dentin, and that can cause teeth sensitivity. There is products that you can use from the baking soda, the normal baking soda. They have implemented it into toothpaste right now because that directly helps sensitivity.
Wow.
But it's a problem that persons have. On bleeding, it's actually natural, a little bit of bleeding when you brush. That is not something to be alarmed of. You will be alarmed if you have excessive bleeding. It's a natural process of the general oral cavity to have some bleeding and some tooth sensitivity, but elderly have more due to the demineralization of the enamel that protects the nerve, which is the pulp.
Wonderful. Okay. How can persons prevent tooth decay from occurring?
Well, like I said, sugary, starchy foods, if you're prone to that, some people like a lot of chocolates. That's sticky. It sticks to the uneven surfaces of the teeth,
Yes.
especially the chewing surface. Some people can get away with that because of the anatomy of the tooth. Their anatomy might have smoother surfaces, and so they might not get dental caries, is what we call it. However, those with deep fissures, those are the lines that one might see on the chewing surface of teeth. There is where those sort of foods may stick there. And especially if you're not a good brusher, you don't like to maintain, as we've said, then you would have caries occurring. Now, we like to tell people brush, 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 but it's when you brush and how often you brush. Usually before going to bed is the best time. If you're going to be using starchy foods, sodas, that sort of thing, you should rinse your mouth out first before brushing and then later on brush. But most importantly, before going to bed. So it all depends on the diet again, as I said.
Diet. It all comes back to diet.
Habitual diets.
Yeah.
So.
Okay, so thank you. We'll be going into a short ad break and be right back.
In this video, we'll show you the best way not only to brush your own teeth, but also how to easily brush the teeth of others. Toothbrushing should be carried out twice a day, in the morning and last thing at night. We must remember that not everyone can brush their own teeth. But when brushing other people's teeth, the principles are the same. Please remember that toothbrushing takes a full 2 minutes. Yes, 2 minutes. Use a small-headed, medium-texture bristles toothbrush with a small amount of fluoride toothpaste. Start by tilting the toothbrush against your teeth so the bristles are at a 45-degree angle to the gum line. Move the brush in small circular movements, a few times on each tooth. Next, brush the outer surfaces of each tooth, keeping the bristles angled against the gum line. Do the same thing for the inside surfaces of all the teeth. Now, brush the biting surfaces of the teeth, on the top and the bottom. To clean the inside surface of the front teeth, tilt the brush vertically for the upper teeth. Gently move the brush long ways down the tooth from the gum for a few seconds. For the lower teeth, tilt the brush vertically and pull the toothbrush gently upwards from the gum for a few seconds. If plaque is not removed from the teeth, it leads to bleeding gums and tooth loss. If you eat or drink sweet things, plaque mixes with the sugar and causes tooth decay. Finally, spit out any remaining toothpaste. Do not rinse the mouth with water or any kind of mouthwash. In this way, the fluoride in the toothpaste will help protect the teeth.
Welcome back. Dr. Sullivan, as we wrap up today's program, could you tell us what is the theme for Oral Health Month 2021?
Well, so far we have come up with a theme that we're going to work because this theme covers the entire objective of this month in terms of what we do. We are looking at maintaining, preserving, and improving oral health, education. Now, through education, intervention, and prevention. To go in the correct order, let's say, okay, you have education, which we're teaching the children and everyone how to go about dental hygiene or oral hygiene. Then we have, with that, we have our preventative measures, as Dr. Karen and Dr. Patterson did elucidate earlier, where we have prophylaxis being done. We did not mention sealants, which are the capture of any of those deep fissures that might be conducive for cavity formation. And most of all, intervention. Let's say we discover someone with a cavity. We're not dealing with extractions. We try to prepare that cavity and fix it. So the problem we still have is our own teeth in the mouth, and is our mouth. Like we said, we try to avoid tooth loss. So at an early stage, in capturing this, which we did not bring out earlier, besides the school program, right, it was touched on that even the health centers, the doctors or the dental personnel, we go into those places to educate the pregnant mothers and the nurses, midwives who deal with these children, so they can identify dental problems. Because not only, as the doctor did explain, the diet is important due to the time of pregnancy, but after birth, sometimes there are some anomalies, defects. So not that we're waiting for the person has teeth, but before they come from that health center or from the nursing home or wherever delivery has been taking place, we must be able to identify whether the oral cavity is in its right condition, as always should be. So imparting of that kind of information to the nurses, to the mothers, and will-be mothers, even fathers, right? They have to be involved in this actual thing, because what you find happen with pregnancy, sometimes the father might be the one who might be involved in say drugs or substances that could contribute negatively toward the fetus or the development of the child. So it's important in all for dentistry, which we all been overlooking. It's an integral and one of the most important part for health. Because like I said, during the early trimester and those trimesters during the developmental stage, a lot of abnormalities, a lot of defect could happen to the development of the jaw, the facial structure. So we need to work with everyone to make health that important. So even those are near or far could experience and we have to get the necessary services like everyone else throughout the country.
And be able to access it.
Definitely.
Thank you, Dr. Sullivan. Before we close, what would be your advice to persons who are probably thinking of going into the field of dentistry?
Dentistry is a wonderful profession, right? It entails not only the teeth, but in terms of the system, the body system. Because like Dr. Karen did explain, right? The mouth is only one organ, right? And we need not to treat it as though we have many organs in the organ of the mouth, right? Losing a tooth, it would not cause any problem. But like health, right? We need to understand the importance of every organ of our body, important how we care ourselves, important how we eat, and like we did mention earlier, it reflects, right? How good we are and how we're able to perform, or even your it influences your education, because if you have a toothache, you cannot concentrate. But if you have more person in the dental field like we're talking about now, right? These person, if grasping the right knowledge and right concept about what dentistry is all about, they have a different approach. Approach is not to just come in, become a doctor, and today just treat people, just extra. I already deal with teeth. We deal with health. And dental care is very much an integral part and important for the body to function effectively.
Can I just add? We have, there are two different pathways you can do into doing dentistry. We have the School of Dentistry, which is UG offered, and that's a 5-year program. But what a lot of persons don't know, we also have the dental nurse program, which is done by the Ministry of Health. And that's a 2-year program. And you need 5 subjects. 3 of them will have to be science subjects. And that's duration of 2 years. Right now, we have a batch of 26 students. They'll be graduating in December. So, and most of them are going back to the region, and that will help a lot with the current of regions. We also train our dental assistants, which is a year. So there's a lot that of dental personnel that make up this dental team, right? I just wanted to mention that. Yeah.
Wonderful. Thank you so much. Thank you for joining me tonight on this program. It has been quite informative. I want to encourage you guys to continue the good work that you all are doing at the dental school. Thank you once again.
Thank you for having us.
Thank you for having us.
To you, our viewers, thank you for staying tuned. I'm Alicia Martin saying goodbye for now.